Many of us believe arthritis to be a condition for the elderly, but in reality, it's a condition anyone, any age can obtain. Arthritis is a problem within the joints. It could be, but not limited to, the wearing away of cartilage, a lack of synovial fluid, which is a nourishing juice for the joints and cartilage, or autoimmunity, which is your own immune system attacking itself. Some factors that contribute to a higher risk of arthritis are your genetic makeup, a physically demanding job, previous injuries, infections, and obesity. There are over 100 types of arthritis that more than 350 million people worldwide share, and 1 in 5 Americans are affected by it. It's a condition for
How has
anyone.
osteoarthritis affected your family and home environment?
It hasn't yet. Since it's minor, I'm able to control the pain by over-the-counter medication and doing hand stretches. And
So does it influence your temper or mood?
yes, it does.
And which daily activities are affected the most by this?
Anything that's meticulous. I work in a hospital, so sometimes taking the IV, attaching it, just tiny things that I have to pinch my hands together, it'll ache. Shaking somebody's hand who squeezes my hand too hard, that hurts.
What's your job in the hospital?
A tech up in the PACU.
So are there some physical activities that are off limits to you that were not before?
Some, like if we get together with friends and play volleyball, I can't really hit the ball too hard with my hands. Really cold weather, they stiffen up. So going to play in the snow and stuff like that, making snowballs, stuff like that, it does hurt my hands. So I just keep my hands in my pockets and watch other people.
Are there dietary precautions you take to manage or stabilize your condition?
The doctor didn't really give me anything at this point, but I just try to eat things with calcium in it, and just try to keep my hands warm when they're feeling cold. Lotion.
And do you go to the doctor more often because of your arthritis?
Not at this point, no.
Excellent. And how does your family behave around you knowing about your condition?
Sometimes they'll tease me because I can't open up a jar and they laugh, or I can't pinch down the can opener and twist it, so they'll kind of giggle and make fun of me a little bit, but they help out.
Arthritis is not a disease that simply affects the old. An estimated 50 million Americans suffer from arthritis, 300,000 of them children under the age of 18. Blacks and Hispanics report more severe pain from their arthritis, and although blacks and whites have similar rates, Hispanics seem to have less. Injuries do increase the risk of arthritis in everyone, and arthritis costs the U.S. economy over $124 billion in lost wages, productivity, and more. It can strike children as early as ages 1 to 3 or 8 to 12, and it strikes females twice as much as males. Animals can also get arthritis, and often for the same reason humans do. A diagnosis of arthritis is the first step towards a successful treatment. To diagnose arthritis, your doctor will consider your symptoms, perform a physical exam to check for swollen joints or loss of motion, and use blood tests and x-rays to confirm the diagnosis. X-rays and blood tests also help distinguish the type of arthritis you may have. For example, most people with rheumatoid arthritis have antibodies called rheumatoid factors in their blood, although rheumatoid factors may also be present in other disorders. The way to treat arthritis is through exercise, especially different types of exercises. Range of motion exercises like dancing will help relieve stiffness and keep your joints flexible. Strengthening exercises like weight training will add muscle, which will help protect the joints. And aerobic endurance exercises like bike riding and running will help keep the heart and arteries healthy, which will help reduce swelling. This, along with a good amount of rest and a good diet, will help you prevent arthritis.
Buenos días, Gisela. Hoy vamos a empezar con unas preguntas. Primero, ¿qué tipo de artritis tienes?
Se llama mild arthritis o la artritis mild, que es una artritis muy suave.
Eso, así que es como temprano en la vida.
Esta, según me explicaron, depende del desgaste normal de los años para la edad que uno tiene. No pregunte cuántos.
¿Y tú has ido al doctor para
Yo
esto?
fui a un doctor internista hace un año y él diagnosticó, por medio de una radiografía, me diagnosticó artritis mild arthritis, porque tenía unos dolores en la cadera que no, pues que no me los aguantaba.
Ah, ¿y tu familia tiene una historia de artritis?
Hasta donde sé, mi mamá tiene un problema de artritis en una pierna y por eso es que no la puede mover, ¿se acuerda? Pero no sé cómo se llama, cuál es la artritis que ella tiene, no la sé. O sea, como eso hay diferentes clases.
Sí. Bueno, ¿cuáles medicaciones o cosas has usado para mejorar el dolor?
No me recetaron ningún medicamento en especial, me dijeron que tomara Osteobioflex, I think, que es como una especie de glucosamina, y que tomara calcio, por supuesto.
¿Y cómo ha esto afectado a tu familia y tu...
Pues a mi familia no tanto, a mí, porque todos los días se levanta uno con dolor en las coyunturas y, por ejemplo, me duelen los tobillos. Este dedo de aquí me duele todos los días. Hace un tiempo hacer una fuerza así, cerrar, me costaba trabajo, pero con ejercicios, y me dijeron que hiciera ejercicios y que tratara de caminar y si podía que aprendiera a nadar, y por eso estamos aprendiendo a nadar.
¿Y esto influencia tu temperamento?
Temperamento. Hay veces sí, hay veces no, depende de qué tanto me duela.
Ah, entonces, ¿cuáles actividades están afectadas más por esto? Por el artritis.
Por ejemplo, abrir frascos, o sí, más que todo abrir frascos o botellas me cuesta trabajo.
¿Y cuáles actividades ahora no puedes hacer que antes podrías?
No, yo creo que yo puedo hacer todas, pero limitadamente, por el momento.
¿Y tienes un tipo de dieta que sigues para manejar esta condición o estabilizarla?
Hasta el momento no me han dicho acerca de ninguna dieta. Lo normal, alimentarse nutritivamente, sin tanto fat y esas cosas.
¿Y qué tan frecuentemente vas al doctor para esto?
Normalmente voy al doctor 2 veces al año.
Así que no es muy serio.
No,
Ah,
bueno, depende como uno lo vea, ¿no? Normalmente la gente no va al médico.
I just want you to know